Hello everyone, my name is Justin Dave B. Gayed, a student nurse from Baguio Central University, and for today's video, I will be doing abdominal assessment return demonstration. Before doing the assessment, ask the patient to urinate first because an empty bladder can make the client comfortable. Also adjust the temperature of the room because the client will be exposed. Okay, sir. Good morning.
Good morning too.
Ako nga po pala si Justin Dave Gayed, a student nurse from Baguio Central University, and ako po yung magiging student nurse nyo ngayong araw.
Okay, sir.
Sir, ang assessment po natin ngayon is abdominal assessment at I will be palpating, inspecting, auscultating, and percussing your abdomen. And yung abdomen po natin is may 4 po na quadrants and ipapalpate ko po lahat yon o i-inspect ko po para makita po kung may mga discomfort or mga abnormalities po in or on your abdomen.
Yes, sir. Yes,
Okay, sir. I will position you later on if I'm done asking the questions before doing the assessment. And I want your honest and active participation.
Okay, sir.
Okay, sir. May itatanong lang po ako. Nagkaroon po ba kayo ng abdominal pain this past few days po?
None po.
Wala naman po. Okay.
Wala po.
May mga symptoms po ba kayo na naramdaman like nausea, diarrhea, and vomiting po?
Wala naman po, Dok.
Okay. How about the change in appetite po, sir?
Wala din po.
Okay. How about the food intolerance, sir?
Wala din po.
Pwede ko po bang malaman, sir, kung ano po yung nakain natin na pagkain this past 24 hours, sir?
Ang kahapon po, sir, is I had, on my breakfast, I had tapsilog. And then sa lunch ko po is nagtinola po. Tsaka dinner po is, I still remember, kare-kare po. Kare-kare. Yun lang po, sir.
Okay, sir. Thank you po. Okay, sir. May I know if nagka-experience po kayo ng heartburn po, sir?
Before, sir. Yes. Pero,
Okay, sir.
wala naman po.
How about the flatulence or belching po?
Well, hindi wala po, hindi.
Okay, sir. Nagkaroon po ba kayo ng dysphagia or difficulty in swallowing, sir? This past few days?
Wala naman po.
Okay. How about hematemesis, sir, or blood vomiting?
Wala naman po.
Okay. May napansin po ba kayong dugo or blood or mucus sa stool po natin?
Wala naman po.
Okay, sir. Sir, may I know if nag-undergo po kayo ng problems or treatment like stomach ulcer?
Hindi naman po. Wala naman po.
Okay, how about gallbladder surgery, sir?
Wala po.
Nagkaroon po ba kayo ng history ng jaundice, sir?
Wala po.
Wala, okay. Thank you. Okay, sir, thank you for answering those questions. I will now position you in supine position. Higa po kayo dun sa kama natin and lalagyan po ko po ng pillow
Sige.
underneath your head and beneath your knees to provide you comfort and reduce the tension sa abdominal muscle po natin.
Sige po. Nice.
After positioning the patient to a supine position, I will now expose his abdomen from the chest to the pubic area. And after that, begin for the inspection of his abdomen. I will inspect for the skin integrity of the patient, also with the contour and its symmetry. I will observe his abdominal movements associated with his respiration, peristalsis, or aortic pulsation. I will be observing his vascular pattern. from here, here, also here. Upon inspecting for the abdomen of the patient, I haven't noticed any striae or stretch marks, and there is no presence of hematoma. I haven't noticed any veins over his abdomen, and there is no presence of scars. And for the contour and the symmetry of the client's abdomen, it is flat and slightly rounded. I haven't seen any bulging or mass formation. There is no presence of abscess or the formation of pus. And about the discoloration, the color is in normal. Wala pong bluish, yellowish, and redness ng abdomen skin ng patient po natin. Okay, I will now proceed to the second procedure, which is the auscultating or the auscultation of abdomen. In auscultating the abdomen of the patient, I will use my stethoscope. Okay, and I will check for the bowel sounds, the vascular sounds, and the peritoneal friction rubs. And with that, make sure that your hands and the diaphragm of the stethoscope is warm to give comfort to the patient and reduce any muscular contraction. Okay, I will now perform auscultation of the abdomen. In auscultating of the abdomen of the patient, I will begin at the right lower quadrant. Right upper quadrant, left upper quadrant, and left lower quadrant. I will now check for the vascular sound. The renal arteries, the iliac arteries, the femoral arteries. After auscultating for the abdomen of the patient, the normal bowel sounds are audible at normal ranges. Okay, I will now proceed to the third procedure, which is the percussion of the abdomen. This procedure is used to determine or check if there are abnormal growth or enlargement of the internal organs, and this is to identify if there is dullness or tympani. This assessment, I will use the systematic pattern, which I will be starting in the right lower quadrant and proceed to the upper right quadrant, to the left upper quadrant, until I ended to the left lower quadrant. After percussing the abdomen of the patient, I will now palpate his abdomen. Palm of your hand slightly above the client's abdomen, with your fingers parallel to the abdomen. Depress the abdominal wall lightly above 1 centimeter or to the depth of the subcutaneous tissue with the pads of your finger. Move the finger pads in a slight circular motion. Note areas of tenderness or superficial pain, masses, and muscular guarding. To determine areas of tenderness, ask the patient to tell you about them and watch for changes in the client's facial expressions. Upon palpating the patient's abdomen, there is no pain verbalized by the patient. No changes of his facial expression. Relaxed abdomen muscles that normally accompanies exhalation. No pulsation felt. And mild tenderness over the sigmoid colon. Okay, next, I will now palpate for the bladder of the patient. Palpate the area above the pubic symphysis if the client's history indicates possible urinary retention. After palpating, I noticed that there is no enlargement of his bladder, and it means that his bladder is in the normal state. Okay, sir, that ends our assessment, and I am grateful that you've answered the questions honestly, and thank you for your cooperation.
You're welcome, sir. Thank you as well.
Okay, sir, rest assured that the information or the data that I've assessed in this assessment is highly confidential between me and the attending physician that I will be referring you to.
Thank you, sir.
Okay, thank you. Have a great day.